Duke University recently announced the creation of the Duke University Health Policy Center. The center is funded by a generous donation from Duke alumnus Dr. Robert J. Margolis and his wife Lisa. We are fortunate to have national health policy expert Dr. Mark McClellan as the Institute's inaugural director. The center, which will be housed at the Fuqua School of Business, will focus its activities serving as a hub for translational policy research and analysis. That is, for supporting the movement of promising ideas and health reform into the implementation of effective policy. Let's hear from Dean Broom how the School of Nursing will participate in this exciting opportunity.
Hi, I'm Marion Broom, and I've met many of you. This message is primarily aimed at those of you who are alums of the Duke University School of Nursing, but there's others of you I have not met. I've been here about 15 months, and there's been a recent development on campus that some of you have heard about, the new the Duke University Health Policy Institute. And so I wanted to take this opportunity just to take a few minutes to help those of you who have an interest in health policy or who were captivated by that announcement to understand a little bit better about how the school is positioning itself to collaborate with our colleagues across campus to really impact the healthcare in our country. So as I started to reflect, I actually received some emails from alums asking how we would be involved. And as I began to reflect on our faculty's talents, we actually have a number of points of intersection that I think we can be either we already are very strong in and we can capitalize on as we work with our colleagues across campus, or that might be a little bit new to us. The first area is advocacy, and I have actually asked Dr. Leanne Simmons and Dr. Nancy Short to provide some leadership in this area. They have a lot of experience working with our students to take them to both Washington, D.C., as well as our ABSN students, taking them here to the state capitol every year to advocate for different issues that have relevancy for nursing. Brett Morgan is also a part of a group of faculty, and I hesitate to name names because it's always possible to leave someone out, so I'm just giving you some selected examples here. But Brett Morgan, who's one of our nurse anesthesia faculty, is also very active at the state level in North Carolina, advocating for an expanded scope of practice for advanced practice nurses, of course, including CRNAs. A second leg of the contribution would be our policy and workforce research talent that we have here, and a couple of names of faculty, although there are many more that come to mind, are Michael Carey is the first one. He's one of our assistant professors, and he has long, for the past few years, he's a new assistant professor, has done research on the effect of reimbursement on care outcomes for elders, specifically related to hip fracture, which is, of course, a growing concern in our country. And Elizabeth Merwin, our vice dean, who has for many years has actually focused her research on mental health issues, especially related to those in rural areas of individuals who live in rural areas. And she and Michael have collaborated most recently on a couple of projects. So we have other researchers who do that kind of research and will be, I think, well positioned to collaborate again with colleagues, but who also will be welcomed by Dr. McCowan and his staff there. And a third area, and a very exciting area, and I know one that Dr. McCowan's very interested in the nursing school participating in, is testing new models of care that will do several things. One, increase access for patients, also increase quality and decrease cost. And these models of care usually will be team-led, be team care, but in many cases led by nurses. And we have a couple of faculty who already are currently involved in some of these efforts. And one is Paula Tanabe, who has focused her entire research program on building care models, champions, for individuals with sickle cell disease. And Midge Bowers, who's one of our faculty, who runs a nurse-led care coordination effort across settings for heart failure patients, another area that is getting significant interest across the country. I think Dr. McCowan and I are both interested in scaling some of these models eventually nationally, again, to improve access, increase quality, and decrease cost. And the last area that we are very active in is the Health Policy Coalition, with 12 other private schools, or schools of nursing and private universities, such as Johns Hopkins, Columbia University, University of Pennsylvania, Emory, etc. And we meet monthly by conference call and then meet in person a couple of times a year. And we have to date met with individuals from CMS, we've met with individuals from HRSA, we have met with individuals from NINR, and to talk to them about issues that have relevancy for health policy, and that particularly have the G&E, for instance, is another area that Duke and University of Pennsylvania's, that's a graduate nurse education funding that we received for 5 years, or that Duke has received for 5 years. So those are just a few of the examples. I hope this helps you to understand how active the school will be in collaborating with, again, our colleagues, our research and practice colleagues across campus, both in Duke Health as well as the larger Duke University. I welcome any of your input, any feedback or input, and I hope that this can expect to see a lot of focus on this in our alumni magazine in the next couple of years. Thank you.